think that's really important when talking with patients and their family members, what their goal is for the treatment, what their concerns are about quality of life. That's a big discussion I have every day, all day, every day. If the quality of life is not going to be there, if they're going to have residual side effects from certain medications. If you're a hairdresser and you're 35 years old and you can't feel your fingers, you can't function. So we have to really listen to what they're saying and pay attention to that, and then navigate through that together to decide what's the best course for this particular patient at this particular time. Of course, you need to give them the risks and benefits of not doing a certain treatment versus another treatment, but I think as advanced practice providers and nurse practitioners, I think we tend to listen more closely to the patients and their concerns when it comes to those things. So sometimes I'm an integral part in adjusting medications, adjusting doses because of side effects or issues they're having that are affecting their quality of life.
Yeah, I agree. Understanding what is their functional status, what do they do for a living, what are their hobbies? I've had many patients that were musicians, so strumming a guitar, if I'm pushing on oxaliplatin dosing, that could limit their ability to do something they love and enjoy. I think one of the complex things about colorectal cancer that I don't think we had enough time to really elicit in our talk is that, again, putting it in clinical context, that I think there is that flexibility in the combination of medicines and when you use them at what time in a treatment course. Another example I can think of, I had a young woman who didn't want to get panitumumab during the summer months because of her rash, and she spends they have a beach house, so did they go to the beach frequently? So we were able to talk through that, and by waiting a few months to start panitumumab, we don't necessarily compromise their care. So I think talking through those treatment side effects, meeting patients where they are at so they can understand risk benefit and what are their goals of care, right? Some people want anything and everything up front, don't change doses, but there's a lot of in between. And I think we are in key roles to spend time talking with patients on that.